Joining us now, Greater Chennai Commissioner Mr. Gagandeep Singh Bedi and Mr. Sridhar, Deputy Commissioner. Thank you very much for your time. So Chennai's numbers hovering around 6,500. Two major challenges in terms of availability of beds, particularly oxygen supply. How are you tackling these?
Thank you. Actually, the government of Tamil Nadu is making a double-pronged strategy in terms of augmenting oxygen beds. The first is that all the medical colleges and private hospitals, the oxygen augmentation over there is being looked after by the health department. But it is the industries department led by Principal Secretary Industries who is arranging oxygen besides the available oxygen from other sources, other states, other countries.
Right.
And every day the oxygen is being augmented in Tamil Nadu. So this is taking care of liquid oxygen and oxygen cylinders which are made available over there. Greater Chennai Corporation as such earlier did not have hospitals with oxygen beds. We had only D types of cylinders here and there. Now what we have done is that we have ordered for 3,000 so far. We are ordering more oxygen concentrators which will act as stand-alone oxygen beds providing up to 10 liter per minute of oxygen. 900 such concentrators have been got. We have already given them to 4 hospitals which we have set up to complement the oxygen beds of the medical colleges and private colleges in 4 different regions. Now, in addition to that, we are also providing these oxygen concentrators to the medical colleges so that in their ground floors where all the ambulances comes and their ambulances have to wait till they give the beds, we can use these oxygen concentrators in the wards in the ground floor itself in order to give relief to these patients who are there in ambulances and so as to make the space free also. So we are expecting that in a week's time, and we have also been doing, our aim is that at least 5,000 plus beds should be set up over and above what was there last year and last week, and every week we will be augmenting it in this regard.
And how is the system of contact tracing happening now, sir?
Yeah, that's a very important point. Contact tracing, what we have done is, earlier actually the Chennai Corporation was getting its tests and then we will go to the houses and trace their contacts. I have passed an act under the Disaster Management Act where I have made it compulsory for all the private labs also to give their test to me, just like some other cities, Mumbai and others have done. First we will get, then we segregate it zone wise, then the next day private labs release the results to the people. Then by the time in the morning itself, these contacts are actually given to the zonal officers, and in the zonal officers are then asked to go to each and every house. Now the strategy is, earlier these people were asked by phone to come to the screening center. Now we have said that in order to ensure that the spread of the disease is contained, we ask our triage teams. Triage teams are the ones who go over there to the each and every house. They check up the oxygen level, they check the fever and other body parameters, and then they decide whether the patient has to be in home quarantine or COVID care center or the hospitals. Now the change strategy is that instead of calling the people to the screening centers, we are sending our triage teams to all the patients who are below 60 to their houses. To all those above 60, we are requesting them, sending them our car ambulances, which 250 ambulances the Chennai Corporation has actually put up in the system, to come to the screening center so that we can have their chest x-rays done, etc. also, because they are more vulnerable and then do. So we are ensuring that 100% patients are tested, then their contacts are also traced. We are aiming at a ratio of at least 1:10 to 15 for every contact to be checked up, traced. It is being done methodically through a computer-based system, and then we are following up the testing of all the contacts also.
Right. It's 1 week into the total lockdown in Chennai and across Tamil Nadu. The numbers have not come down yet in that sense. What are your projections? When do you think we can see the numbers declining?
See, the lockdown is there. The enforcement strictness is being undertaken. Vaccination drive is being put through in a big way. The time limit the time to take the testing etc. has actually also been reduced. There is hardly any delay in most of the cases for the testing. Plus, we are actually following household visits tele-counseling all the persons through special, we have actually recruited 300 final year MBBS students in our control centers. They are talking to all the positive patients, asking them to be on home quarantine if they are on home quarantine. All these efforts, in my opinion, will have an impact after some passage of time. The disease the increase of the disease was rapid. It has slowed down, as you know, the statistics. We will not expect dramatic results in a day or two. It takes time, but I am sure the efforts of all the stakeholders will definitely bring in results in the coming weeks. Thank you.
And now you have also launched a drive to vaccinate 1 lakh people across Chennai. How is it going?
Actually, so far, out of 45 plus category, if we see, there are about 23 lakh population, out of which we have already vaccinated about 13 to 14, about 13.5 lakh persons we have vaccinated. Now, we have set up a target of vaccinating 1 lakh in every 4 days. In fact, yesterday it was about 25,000 persons. The day before yesterday it was 20,000 and all. It's the number of people is increasing. We have roped in philanthropic organizations to help us in creating awareness. Rotary, Lions and other philanthropic organizations are there with us. We are organizing at least 100 special camps besides the camps in the primary health centers in the city to ensure that people don't have to walk long. We are also giving frequent bites through media like you to the people to tell that vaccination is absolutely safe. And even if somebody gets COVID, it will not be life-threatening in most of the cases. So we are actually quite sure that the progress in vaccination will increase, and government will also in future take a decision about the 18 to 45 age category also. We are also now devising a new strategy in order to help the differently able persons. We are actually setting up a helpline so that they can tell, and our endeavor is that we should try to vaccinate the differently able persons right in their houses also, for which a strategy is being formulated and announced shortly.
As a commissioner, what will be a message for Chennaites, especially when they say we try for long outside hospitals for an oxygen bed?
I have got the message for the people is, as a commissioner, number one, please be very careful about your symptoms. The day anybody has symptoms of fever or body pain or loss of taste or throat pain, etc., a large section of the society feel that no, it's only a normal fever, etc. It's not a body. In this point of time, 90% plus most of the cases are COVID positive in case of a fever being there. Please, my request to all citizens, not only of Chennai and others, is please get tested on day one. If you get tested on day one, now Chennai has also evolved a new strategy. We don't wait for the patient to get his test result. The day he comes for the test, if he has symptoms, as per the health protocol, we give him kit right in his hand. This is vitamin C, this is zinc, this is paracetamol, this is the Ayurvedic kit to have the liquid. So at least ensure that your immunity starts building from day one. So my request to everybody is don't be complacent. Right test from day one. If you test to be COVID positive, immediately go for, if you are having a single home house, go for the COVID care center in case you don't have symptoms. In case you need hospitalization, contact our zonal officers, or the government has also set up a war room where the critical patients who need the hospital and the ICU ventilator, there is a team of a number of IAS officers of Tamil Nadu's war room who work 24 hours. In fact, we also send our message to 104 war room in case of critical patients. And if not in 1 hour, in 2-3 hours, they are able to search, ensure that the bed is made available anywhere in Tamil Nadu, of course, for Chennai or all around Chennai itself also.
And Mr. Sridhar, tell us about the core ambulances. How do people access that, and how does it help?
Okay. So now we've started this COVID special ambulances across all zones of Chennai. So idea is all the patients above 60 years and all those people who need hospital facility, who may not need oxygen, because all the 108 ambulances are tied up with COVID patients who need active oxygen support. So for all these kind of cases, to reduce the load of 108 and also to provide immediate help, immediate relief to the patients, we have started this facility. It has got very good response. Last 2 days we have been moving more than 700 patients, and we hope we can give immediate relief through this facility in coming days.
And to summarize, sir, what are the challenges, key challenges at this point?
Uh, Let us go from bottom to top. The first and foremost challenge is the people not adhering to COVID protocol. We ask them to, that there are timings up to 10 a.m. for the people to buy vegetables or essentials. Many a times we feel that the people actually go with the mask with the nose not being covered, or they go unnecessarily, too many number of youth especially, they also try to go around in this regard. COVID protocol in many areas is not being followed. Unless the society cooperates, it is not, it will never be successful. This is the first challenge. Second challenge is people delay in coming to the health authorities for their treatment.
Right.
And that delay proves to be fatal in a small number of cases about which we are worried. So that's why, as I told, do the treatment from day one. The day one you have a test, come to the center, presume that you are COVID positive, start taking treatment, get your test done, and then take appropriate treatment in this regard. The third challenge is hospitalization. In fact, of course, oxygen, availability of oxygen is a big challenge which the health department of our government and industries department is trying to tackle quite effectively, but still it's a challenge. At any point of time we have a shortage of beds, but we are also trying to ramp up the numbers through oxygen concentrators. The last challenge I will also say is almost everybody who is not having symptoms likes to be in the home quarantine, whereas in Chennai city itself I am having nearly 3,500 COVID care center beds vacant. If you are not having any breathing problem as of now, but if a person feels that he cannot be properly isolated from his homes, we have been sending the message that come to our COVID care center. The government and the Chennai Corporation gives them food 3 times a day, along with the supplemental food, along with the doctor treatment. But the number of takers is not as we expect. There are so many beds vacant. I will request everybody who is on home isolation but who is not able to maintain that distance from the other family members to come to the COVID care center beds.
In terms of the crematoriums, how are you monitoring that?
It's an important issue. Crematoriums, in fact, every day I have a review. There are nearly 146 crematoriums and burial grounds in the city. In fact, we have our mornings anytime. I have been visiting, I and my deputy commissioner visit crematoriums almost every day to see if there is a wait.
Right.
Mostly in the mornings there will be no wait for that. In the afternoon, suddenly for the COVID death and the normal death, people actually come at the same time. So, in order to ensure that wait list is not there, I have put a special team under the chairmanship of senior most chief engineer of the city to guide the executive engineer and sanitary officers to redistribute in case there is a load in any particular place. And I have got on my phone the CCTV camera lead of all the crematoriums across the city. At any point of time I can see outside how many mortuary vans or other vehicles are
Live streamed.
Yes. So we are also going to go bring it online regarding the availability of the crematoriums. Right now, we are able to tackle the challenges. We have also told the hospitals to release the COVID death bodies in the morning so that there is an equitable distribution. But this is a challenge and we want to ensure that there is no wait time for anybody. That's what we are having our endeavor to. We may also go for further machinery it is required, but right now the redistribution is okay. Yesterday night when I checked up late in the night, there was nobody waiting actually.
Thank you so much for your time. Thank you very much. That was Mr. Gagandeep Singh Bedi, the Greater Chennai Commissioner, and Mr. Sridhar, Deputy Commissioner, talking to us about the challenges and the strategy being adopted in Chennai with Shah Vijay, Sam Daniel, Find It TV.